Welcome to the OncoPT podcast, where you'll learn from oncology experts, practitioners, and patients to help you on your journey to become a confident and competent OncoPT. Here's your host, Elise Cantu.
Hello, OncoPT, and welcome back to this episode of the OncoPT podcast. Now, we are continuing our CSM preview sessions. We are getting closer to CSM. I am so excited, not only for, my own session, who I am also presenting with this amazing speaker we have this evening on the podcast, but also for this speaker's other session that is going to blow your mind at CSM. So we will talk all about the deets, when it's going to happen, where you need to be. But for now, please join me in welcoming Dr. Alexandra Hill back to the OncoPT podcast. Alex, welcome back, my friend.
Thank you. Always so amazing to be on your podcast and just be in your presence. So thank you for all that you do in this podcast that is so amazing. So thank you for having me on.
Okay, well, the feeling is definitely mutual. Now, if you don't know Alex yet, if you have not come across her on the internet, Alex is a prolific voice within OncoPT, but also within OncoPelvic PT. That is probably where you know her best, as the brains and the beauty and the brilliance behind OncoPelvic PT. Now, Alex, can you tell us a little bit about, we also have a whole other OncoPelvic PT who is not with us this evening, but is also going to be joining you at this session at CSM. Could you just give us a little intro into our missing friend here this evening?
Yes, absolutely. So Dr. Rebecca Seagraves is an amazing, not only physical therapist, but just human. I met her when I was at Duke University. We both did the residency through there. She was a year after me. And the things that she has done now in her time of being a licensed PT has been short of incredible. She's a true trailblazer in especially the pregnancy postpartum population, and even more so in the acute care phase. She's really pushing for advocacy legislation, change on a system level, not just an individual level with just one-on-one with our patients, which is so needed anyway, but we still need things to change on a broader scale. And so she's just doing amazing things. She's out on the West Coast. She is a PT clinician. She teaches, she has a company, and she does a lot of training for, again, not just PTs, but also for OTs and also for just the larger healthcare systems in general. So she's amazing. I'm so lucky to know her and be able to present with her on our upcoming topic for CSM.
So last year, I was fortunate enough to get to go to your session that you presented with a different team, but then also Rebecca's session that she presented with her own team. And so when I found out that the two of you were coming together for a super CSM session, I could not wait to have y'all back on the podcast. So can you tell us a little bit about your CSM session called Ending the Unexpected? Wait, it's expecting the... I typed that wrong. Oh my God, I'm so embarrassed. Whoopsies. Let's try that again.
Typos go. That's okay.
Oh man. Expecting the unexpected. I knew why. I was like, why does that sound weird in my mouth? That's why. Let's try it again. Expecting the unexpected, cancer care during and after pregnancy, which like maybe ending the unexpected is like a better,
we
a
would
goal
love
to
to
strive
end
for,
the
but
unexpected.
Until then, it is expecting the unexpected, cancer care during and after pregnancy. Tell us all about this, Alex.
Yeah, so I had reached out to Rebecca after I'd worked with a patient who previously had cancer as an adolescent young adult, so our AYA population, and then was, pregnant, but she was so scared during her pregnancy about what her past treatment, like how would that impact her current pregnancy? How would that impact her outcomes, her morbidity, her mortality? And so I was thinking about this, and I was doing, my own lit research, because this is a more uncommon population that we see. I think it's like 1 in 2,000 people or less. So it is uncommon. And I can get into a little bit more about why it's becoming more common to start to see this population. But there really wasn't a lot out there. So there's
Mm-hmm.
not really a lot of guidelines that are available on the oncology side, like on the medical side, and then even less so on the rehab side. And shocker, big alert there, right? Like in rehab, we always need more research, especially in these two
Mm-hmm.
particular specialties of pelvic health, women's health, and oncology. So together,
Yep.
woof, like we just don't have a lot. And so I was like, well, we need to do something about this. So I reached out to Rebecca. I was like, who would be the best person for this? Oh my gosh, Rebecca, of course. And so I reached out
Naturally.
to her and she's like, yes, absolutely. And so we are talking about, again, kind of expecting the unexpected. What happens when these two worlds collide of this really amazing, exciting life change of being pregnant and bringing a new life into this world, and then potentially a soul crushing, world ending diagnosis of cancer. What happens when those interact, and what's our role in rehab? And we actually have a third co speaker who is going to be with us. She and Rebecca used to work together and are friends, and she's an OT, and she was pregnant when she was diagnosed with breast cancer. And so she's going to be sharing her story at CSM. So I don't want to take away too much of her, the impact of her telling her own story, but she will be with us at CSM sharing her story as part of kind of a panel discussion and sharing her experiences.
Mm-hmm. Can we give major props first of all? Like this is such a really it's a niche topic area, but also a really important. And as you mentioned, and as I imagine we're going to talk about a little more, this is a growing area. Unfortunately, this is not going
Yeah.
to be a, like, it's going to die off. We're probably not going to see this anymore. But what a powerful opportunity to, elevate and potentially center the patient voice at
Yes.
our CSM conference. This is something that Scott Capozza has been a really
Yes.
big proponent of, and actually
Huge.
did that in their session last year, where it was entirely their whole panel was cancer survivors themselves, which was amazing. And so I
Yeah.
really want to call that out, because that is very, I think, unusual still at CSM, and I'm very, very excited for this. So Alex, Rebecca, thank you for doing that, because I'm really, really excited to hear Molly's story. Now, can we go into a little more of, you mentioned that this is a growing area. What are we kind of looking at? What's the landscape right now of this, Alex?
Sure. So, especially for the OncoPTs out there and OncoOTs, we know that unfortunately we are starting to see more and more younger ages of people getting diagnosed with cancer. So, people are getting diagnosed earlier. Um, on the flip side, on the women's health side, what we know and what we see is that people are delaying having kids
Mm-hmm.
until 30s, early 40s, even.
Mm-hmm.
And so when we look at oncology age trending down, childbearing age trending up, we have this intersection of now we're starting to see these particular cases rise of people who are pregnant who also have either a history of cancer, diagnosed with cancer, or really in the first couple of years after they deliver that they're diagnosed with cancer. Because
Mm-hmm.
as we know with people who are pregnant in the postpartum period, it's not like, okay, like you delivered 6-week checkup, you're good to go. Like, no, these physiological changes continue. And so now people who are in the postpartum phase are also now trying to manage these long-term and late side effects of the cancer treatment.
Mm-hmm.
So it's a really changing new landscape that we're trying to navigate in rehab and oncology as well, because there's not a lot of oncologists and people on oncology teams who also have the skill set and confidence and willingness to work with this
Absolutely.
population as well.
Absolutely.
Let alone not getting into politics, but healthcare is politics, but also talking about our current landscape of fertility, of
Right.
pregnancies, of termination. And those conversations are already some of the most difficult that people have to go with. And now you're adding the layer of oncology on top. And it's
100%.
a whole, yeah, it's really, it's a very tough topic to get into.
Absolutely. And I'm really glad you brought up, this is not, again, we talk about this all the time on the podcast. We don't live in silos. As much as I would really love genuinely to go to work and to just work with my patients in my
That'd be
nice little
amazing.
clinic
That'd
that I
be
have and not
amazing.
worry about the outside world. I would love that. But that's not the reality. And, Alex, you live in Florida. I live in Texas. We've had
Yep.
mic conversations about this before. How critical to really appreciate that there is more of a role that, this cultural landscape that we are in is having an effect on all of this, layered on top of this intersection between, like you said, increasing maternal age, decreasing age at which we are seeing these diagnoses happen. It's very, very unfortunately pertinent. And, I think that really lends itself to, this is a growing patient population that we are going to be seeing, I think, because of that.
Yeah.
Now, I'm really
absolutely.
curious, Alex. So I've seen, so this person was not my patient, but I encountered her through my work at the cancer center. Unfortunately, she was pregnant. She was expecting twins and unfortunately had been diagnosed with breast cancer. And I remember, again, this was kind of secondhand, but I knew that her oncologist, they were doing some treatment, but they were also not pursuing the typical, like, once you're diagnosed with this kind of breast cancer, this is the regimen that you undergo. It's very structured for most people. In this case, it wasn't, because in this particular person's circumstances, they were concerned about this particular chemo crossing the placenta and damaging, the children that she was growing inside of her. So for the OncoPT, who is like, I don't know a darn thing about this, the pregnancy and cancer stuff, can we spend a little time talking about how pregnancy kind of complicates or changes how we treat cancer when a person is actively pregnant?
Yeah, absolutely. So, and we definitely go into this teaser in our CSM talk.
Excellent.
We talk about,
Excellent.
Rebecca does more on the acute side. I'll talk more on the outpatient side of what to look at with your examination, like what interventions, what to tailor, that kind of thing. And so, like you said, although we have some pretty well established guidelines for example, breast cancer treatment, which is, breast cancer is one of the highest frequency of cancers seen among people who are pregnant. And when we now add in the pregnancy component, now we're having to change, as you said, how these treatments are utilized, when they're utilized, or if they're utilized.
Yeah.
So, for example, chemotherapy is contraindicated, is not recommended typically in the first trimester. It's going to be the most likely time that there can be some of these teratogenic effects, that it's going to pass through the placenta, that there's going to be a higher risk of mutations essentially for the fetus. And then it's also recommended to stop chemotherapy at 35 weeks or at least 3 weeks prior to delivery to allow the blood levels to come back to normal, basically. And so balancing when that chemotherapy is, pausing it, and then when can you restart, and then needing to go through, is this going to be going through the breast milk? Are you breastfeeding? Are you able to breastfeed? Did you have, for example, a total mastectomy during your pregnancy and now you cannot breastfeed? Right. So there's a lot of other things to consider, like you said. Hormone therapy is typically contraindicated. Immunotherapy, like, we just don't have as much research on that, especially in this population anyway. And you think about the potential effects of just the immune system anyway, of a person growing this beautiful baby inside of them. We don't want to then add in these immunotherapy that heightens that immune response of the pregnant person. That could lead to then some other issues that are not going to be good. And so it's also, when we look at, we see the patient come in front of us in the clinic, and it's looking at things that could be masking or mimicking things that you typically see during pregnancy, or things that could be a warning sign of cancer or a progression. So fatigue, anemia, breast changes, like these are all things that are not uncommon during pregnancy, but also potential warning signs of cancer or side effects from their treatment. So there's a lot of overlap with it. What I typically recommend for people if they reach out is, if you are an OncoPT, tag team with a pelvic PT.
Right.
If you're a pelvic PT, tag team with an OncoPT. Like, even if you don't have someone in your clinic, if you can at least find someone in your, well, I guess it's going to depend on how the telehealth ruling goes for 2025, but
also true.
Access to care, boy, oh boy. But while telehealth is still around, tagging someone at least in your state who's able to help kind of navigate this with you and with the patient can always be really helpful. We can't know everything. Even for me, like with pregnancy and postpartum, that's not the primary population that I work with. It's like, we need to make sure that we're working with people who are the experts in these certain populations, especially when we're working with a really complex case like this.
Yeah. Yeah.
Ask for help, friends.
Exactly. And I really appreciate the, permission, if you will, of you're not expected to know everything, dear listener. We don't expect that from you. We also don't expect that from ourselves and from each other. So
yes,
let's have some grace. Let's have, a gentle approach to this. I am going to give a little plug here. What a great opportunity to utilize the cancer rehab community and connect with some of these professionals out there who maybe have a little more experience with this.
Yes.
And of course, go to Rebecca and Alex's presentation at CSM. So you can also connect with these people here. Now, where I do, so as I mentioned, I don't have as much experience in the person is pregnant and also undergoing cancer treatment, but I unfortunately have a lot more experience with patients who are pregnant, they give birth, and then they are breastfeeding. And I've heard this many times, and I don't know if this is anecdotal, if this is actually a thing, but I've had several patients who have told me over the years, I was breastfeeding and I thought I had a clogged duct. And so I went and got it checked out, and fast forward, unfortunately, it was then discovered to be cancer. And so I have a lot more experience working with patients who are immediately or like in the, relatively short term, postpartum phase. And now, in addition to, we've got a baby that we're, trying to keep alive and raise. Now we also have a cancer diagnosis on top of that. What's kind of been your experience with that, Alex?
I've had one patient in the past with kind of a similar situation. I have certainly heard of others, and other therapists have contacted me about that, or just in conversation, like that definitely comes up. And I don't know if it's because maybe with the, these huge hormonal and stress shifts, like if that's something that could be triggering the autoimmune, or maybe it's just simply that people are feeling their breasts more, right? Like when you look at the data and when people are actually doing these regular self-checks, that they're catching it more, right? And so could it also be because people are just feeling their breasts more and paying more attention to their breasts? I don't know, but I think that's a really interesting thought to look into.
I know. I feel like that, again, a lot of intersection between a lot of different things. So when it comes to, there's potentially, as we've mentioned, there is maybe not as big as, like breast cancer as a whole, but this is a growing patient population that we need to be paying attention to. And we need to be prepared for when they walk through our doors or when we walk through their door and go to see them. So what are some things that attendees are going to take away from your session with Rebecca and our guest speaker and patient perspective, Molly, who is also not here this evening?
Yeah. So what we want to do is not just, and I'm going to credit this to Rebecca. She's an amazing, I'm trying to think of how to word, like storyteller to get the didactic information across in a meaningful way. Like her skill with this is incredible. But our goal with this talk this very short 2-hour talk is to really weave in our own patient stories and Molly's story, and while bringing you the data. So what are the statistics? We also focus a lot on minorities, especially on Black mothers and Black pregnant people, because we also have that disparity as well for
100%.
maternal health and for cancer health disparities. We talked about this at my CSM talk last year that I did with a wonderful group of people, are those cancer health disparities. And so we weave a lot of that in. You'll also get some information about what are the recommended guidelines available right now for some of the more common cancers diagnosed during pregnancy. And then what role can you have as a PT, to the OTs out there? This is a PT conference, but what is your role, not just on a therapist clinician level, but what can you do advocating in your hospital system, in your community, at a legislation level? So we want people to be empowered by this talk to then be able to take action. And what does that look like? And then we'll also, like I said, go through some more actionable clinical things, including what to look at with your evaluation, what to look at with the interventions that you want to provide. Because again, we're looking at, for example, balance. Balance is huge for working on with people who are pregnant and postpartum, but also going to be huge for people who have CIPN, right? There's going to be these overlaps. So we will be going through some of that as well. Again, we want you to be able to take things, and be able to apply them to the clinic, but also looking at a broader scale. We have to be part of that grassroots effort ourselves as therapists to advocate for our patients.
And to piggyback off of this, Rebecca is a positively captivating storyteller.
She really is.
Oh my God.
Really
again,
is. You hang on really every word.
Yes. Oh my gosh. That was the thing, is every time I've had her on the podcast and when I've seen her present, I'm just like, I think there's drool coming out of my mouth of like, oh my God, this is amazing. Right. And then I love, because she doesn't just leave you with a story. She also, gives you a 1-2 punch of, and now here's what to do in your own community, in your own practice with your own patients. And my friends listening, if you need to be reinvigorated about OncoPT and physical therapy and rehab in general, you need to go to this session because of those reasons. And you get Alex also at the table. I mean, my God. I'm telling you, super CSM session here.
She'll bring the storytelling. Last year at CSM, oh my gosh, there was a balloon that was deflating.
Oh my God! Yes!
During the talk. And it was so distracting. And there's a balloon here. And remembering oh my gosh, we're recording for people that can't see anything. And I'm talking about a balloon. So I'm the gaffes. I'll bring the humor typically.
I was sitting next to Scott in the very, very back of that presentation. And we were doing this, watching you and then turning to the balloon. So, can confirm. But
it's going to be, we're really excited about, we're putting it all together right now. All the slides and going through what we really want to come through with this talk. We're trying to be very intentional with it. And we also don't take lightly that we are actually the very first session at CSM for APTA. So this is through APTA pelvic. So the OncoPTs, this is under APTA pelvic, but we are 8 a.m. Thursday morning. So get ready for a heavy and meaningful, and as Elise said, hopefully invigorating talk that we'll be doing.
See, that's why I want to push back. I agree. This is going to be a heavy topic, especially because, we're dealing with some really heavy topics between cancer care and pregnancy, especially the combination of the two. But if you want to get that fire lit under your butt again and to walk away from CSM and just be like, I'm ready to get out there and make a change, this is it. I can't think of a better way to start off CSM than with this exact topic with these exact speakers that we have lined up here. So to recap, in case you missed it, this is the very first session of CSM. So on Thursday, February 13th at 8 a.m. is when Alex and Rebecca will be presenting along with Molly, who I'm very, very excited to hear from.
Yeah, she's incredible.
If you had to boil it down, Alex, what is one thing you hope that attendees will take away from your session at CSM?
Don't be scared to work with this population and advocate for them. We're gonna give you the tools. You just got to take them and run.
I love that. I mean, isn't that the motto for all of oncology? Like,
pretty much.
If you can work with a person who has cancer, you can also work with the pregnant person or the postpartum person who has cancer. I believe in you, friend. And I know Alex and Rebecca believe in you too.
Yes. I would also recommend, also one other thing, I would recommend getting there early. We were advised that they're expecting a large crowd for this talk. So I would recommend getting there early for this talk.
All right.
It will also be on demand. So for those of you that aren't either able to be in the room or you're not able to be in person for CSM for whatever reason, it will be on demand as well.
Perfect. That was actually going to be my wrap-up question too. So on demand. So if you are, struggling to decide between sessions, this is going to be on demand, so you can always watch it later, which is amazing. We love that.
Yep.
Happening Thursday, February 13th at 8 a.m. And remember, this is going to be under the pelvic health section. It is not under oncology. So if you are looking for it on the CSM website or looking for it in the app, make sure that you are looking under that pelvic health section. And again, you will be looking for expecting the unexpected cancer care during and after pregnancy, not the botched topic title that I gave at the beginning of the episode. Whoops-a-daisy.
I think I'm going to actually start the session by saying that.
I'll be a consultant on this very important topic. Just the title, though. Oh my gosh. Well, we will definitely be linking all of this information in our show notes. I will also link Rebecca's contact information. Yes. Alex, since I have you here, where can people connect with you and follow you and learn more from you?
Yeah, I am the OncoPelvic PT on pretty much every platform, including TikTok, but maybe that might be changing. But YouTube, Instagram, Facebook. I have my own website with courses, and I get always, just like Elise, always open for people reaching out with questions or, help with different cases, that kind of thing. I love being a part of your community and seeing all these other questions. So definitely, if you're not a part of her community, you need to join that. But yeah, OncoPelvic PT.
Amazing. And we will link all of that, of course, in the show notes as well. Alex, thank you so much for coming on the podcast this evening. I so appreciate your time. I really appreciate you coming on and talking about this session and hyping it up. I'm really, really excited to get to see it and to see the turnout. I'm going to hopefully elbow my way in at some point because this is a must. A must.
If not, I'll smuggle you in.
Oh, perfect. I'll just sit under the table and be in awe of your awesomeness. Oh, I love it. One more time, the session title is Expecting the Unexpected Cancer Care During and After Pregnancy, happening Thursday, February 13th at 8 a.m. Speakers, Alexandra Hill, Rebecca Seagraves. We cannot wait to see y'all there. And until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.
Thank you so much for listening to this episode of the OncoPT podcast. If you'd like to help support the podcast, please share it with others, leave a rating and review, or support us on Patreon.